So it's a pleasure to be here today. Um, like many of you, whether you're in academics or in the public sphere, we began our career with the belief that if science emerged or risk assessments were done, things would happen, policies would be made, people would be happy. But it isn't that easy, is it? The first 10 to 15 years of my career really focused on science. I believed if we knew how to protect people, children in particular, from lead, we would do it. Of course, there's always the question of whether it's cost beneficial, but even when it's cost beneficial, we do too little. So the last 10 years, I've been trying to understand why. And I don't obviously have all the answers, but I do want to help to start a dialogue about this. I'd like to start a dialogue about why we fail to translate science to policy and ways to communicate the importance of our research so that it gains traction. And the videos in particular I made them along with a lot of other people that helped to reach out to the broader public, because it's not enough to talk to the policymakers. It's not enough to talk to the physicians or the nurses. In the end, I think the target is moms. So today I'm going to do it in the context of little things matter. Little people matter. Children matter, or they should. And I'm also going to do it in the context of low-level exposures to toxins, which for a long time have been dismissed as inconsequential. From the standpoint of children and toxins and the development of brain-based disorders, these brain-based disorders are now epidemic. About 1 in 6 children are affected by one or more brain-based conditions, from anxiety to conduct disorder, ADHD, autism, depression. And we're beginning to recognize that environmental toxins or toxic chemicals play an important role. To be sure, there's a variety of other risk factors that contribute. You can see here quite a few. But many of these also interact. A child who's iron deficient is more likely to absorb lead. A pregnant woman who's exposed to tobacco, either by active smoking or passive exposure, has less folate in her serum to pass on to the fetus. So the idea that we should pit one of these against another is really silly, and yet that's what we too often do. Have you adjusted for this? How do we know it's not that? In the early stages of research, of course, that's important, but at some point, I think we have to recognize that most of the diseases and disabilities are the consequences of cumulative impact of a whole host of subtle risk factors that add up. And yet still we search for that ever elusive single major risk factor. One of the reasons I think we can't gain any traction for public health is that we're entranced by technology. We've spent a vast fortune on what has been, with the exception of antibiotics and vaccines, a never-ending, ever-elusive search for cures. Yes, we have miracle drugs like insulin, and we all want to have access to medical care when we or our loved ones are sick. Yet, the fixation on technology fails to recognize or acknowledge that the pandemic of consumption, the worldwide epidemic of death and disability from chronic disease, is largely due to innovative technologies of the past. And yet somehow we're arrogant enough to think that we're going to solve these with new innovative technologies. That's not to dismiss technologies, but we have to be much more thoughtful about how we make our investments. Let's take an example, autism. Autism, as you all know so well, has risen dramatically. And while there's a variety of reasons for this, it's clear that even after accounting for changes in the severity of the disorder, the age of diagnosis, that it's risen dramatically. And it's risen too fast to be accounted for by simply genetics. Strangely enough, though, in the first 10 years of this century, we spent over $1 billion on genetics to study the etiology of autism, and 40 million, or 4%, on environment. I'm really struggling with this. Is it simply the arrogance of geneticists? That's a bit too simple. Is it because we in academics don't want to stop the pipeline of funding and we're afraid to criticize the way research is funded? But this really is beyond silly. It's very troubling. Now, all told, about 15% of cases of autism can be attributed to genes. That's the most recent example. And I'm convinced that's an underestimate. And I think it's an underestimate because the vast majority of genetic studies haven't considered environment when they've studied genes. And so they're going to miss many different signals of genes. But let's take a look at what's behind this. Too often, despite this age-old argument of nature or nurture, we still tend to think of genes and environment kind of like this, two separate boxes. I can't tell you how many papers I've read. 70% of ADHD is genetic. 70% of autism is genetic. 70% of almost everything is genetic. And that's based largely on studies that don't look at the environment, which reminds me of a good friend and colleague who studies the impact of soil lead levels on blood lead. He doesn't study paint or water, and he continues to conclude that soil lead is the most important source. Of course it is. If you don't study it, you can't make any calculations about it. So what might be a different way to think about it? Well, what if we thought about it like genes and environment contribute to complex diseases? This is actually the way we do think about it, or we should think about it. The vast majority of common public health diseases, autism, ADHD, depression, cardiovascular disease, obesity, diabetes, are due to the interplay of genes and environment. Probably over 90%. Sure, there's a few things at either end, traumatic brain injury. You know, maybe some of us are a little bit more resilient when our heads get hit by a truck, but by and large, it's an environmental problem. On the other end, of course, we have some conditions that appear to be predominantly genetic. Now, that doesn't mean there isn't an environmental component. Cystic fibrosis, people who have cystic fibrosis and are exposed to tobacco smoke don't do quite as well on average as those who aren't exposed. But by and large, most of the conditions we're concerned about are complex diseases. Now, this is pretty cool, and I think it's really should be quite revolutionary if we simply took this basic idea that Jeffrey Rose shared. If causes can be removed, then susceptibility ceases to matter. That is, if we really cared about prevention, we don't necessarily need to know the underlying genetic risk factors. It can be valuable. I've done it. I'm not dismissing it. But what's the real goal? Is it to find the cause and prevent the disease, or is it a cure? We've been focused on a cure for over 50 years, and that did make sense 50 years ago. The emergence of chronic diseases, we didn't know what was causing them. We saw people dying. We saw people suffering. What were we going to do? Find ways to treat it, of course. But now, 50 years later, we know a lot about what's causing these diseases and disorders. There's some uncertainty, of course, but we know enough. And yet we seem to be stuck. We haven't evolved. And I want to understand why. All right, that's the context. Now on to environmental toxins. The vast majority of the established toxins were recognized by environmental disasters, like this one, Minamata Bay and congenital mercury poisoning, that woke us up to the idea that the developing fetus, the child, is uniquely susceptible. The mother, of course, was the one who ingested the contaminated fish. She appears normal. Sure, there's some subtle effects, but it was the child that was devastated. But these disasters are really just the tip of the iceberg. When we think about the vulnerability of the developing brain, we know that the blood-brain barrier isn't fully formed, and it's more permeable to toxins. In fact, lead can actually damage the blood-brain barrier and make it more permeable to other toxins. Rapidly growing cells are often more vulnerable to toxins than slow-growing ones. That's the basic principle by which we treat people who have cancer. We treat them with poisons with the hope and the titration to try to focus on the fastest growing cells, the cancer cells. So when the brain is undergoing rapid growth in other tissues, that's when it's going to be most vulnerable to external toxins. Brain growth occurs over a longer duration than other organs, and by that reason is also more vulnerable. The fetus and the young child may lack some enzymes to detoxify enzymes like PON1. And finally, as you all know, young children often put non-food items into their mouths. About 30% of children in our study were reported to put soil or dirt in their mouths. And pound for pound, they ingest more water and more food. If it's contaminated, they'll have a higher body burden. Some of you may have seen the video that we put together. I want to show just a little bit of a snippet from it to try to make a few points. How's that?
It's true, not all chemicals are bad, but toxic metals like lead and mercury are found in all of us. So are persistent toxins like PCBs and endocrine disruptors such as bisphenol A and flame retardants. We've been studying the impact of toxins on children for the past 30 years and reached the inescapable conclusion: little things matter. Toxins can have a lifelong impact on children. We've also discovered that extremely low levels of toxins can impact brain development. Let's take a look at the percent of children who are exposed to some of these toxins using a national study in the United States. To keep it simple, we'll use 100 children to represent all children. Mercury is found in 89% of children, primarily from eating large fish contaminated by pollution. Lead is detected in the blood of all children, regardless of race, income, or where they live. Over 80% of children are exposed to organophosphate pesticides, mostly from food. All children are exposed to PCBs, a persistent pollutant that was banned in the 70s but will linger for generations. Bisphenol A, or BPA, is found in 96% of children. PBDEs, a type of flame retardant, are found in 100% of children. But these toxins don't occur in isolation. Children are exposed to many toxins and dozens of untested chemicals all the time. Let's take a look at the body burden of a typical child, one toxin at a time. If each marble represents 1 part per billion of a toxin, this figure represents the body burden of a typical child. 1 part per billion is deceptively small. It is only about 2 tablespoons of sugar in an Olympic-sized swimming pool. But chemicals can be biologically active, even at very low levels. The chemical industry has tried to assure us that concentrations of these toxins are too small to cause harm. But chemicals designed by drug companies to alter behavior, like the prescribed dose of Ritalin, a drug commonly used to treat children with ADHD, is active at levels about the same or even lower than toxins found in the blood. Besides, a lot of studies have shown that some chemicals can be toxic, even at very low levels. As the body burden of PBDEs in pregnant women increases, the intellectual ability of their children decreases. Let's take a closer look. As the level of PBDEs in mother's blood increases from 10 to 100 parts per billion, the IQ scores of their children drop by about 5 points. We see a similar pattern with organophosphate pesticides. As the level of organophosphate pesticides in pregnant women increases from 10 to 75 parts per billion, the IQ scores of their children drop by about 5 points. In the 1960s, hundreds of children died from severe lead poisoning every summer. Since then, much lower levels of exposure have been shown to result in learning deficits and brain disorders like ADHD. In fact, the World Health Organization and other agencies agree there is no safe level of lead exposure. As the level of lead in children's blood increases from 0 to 100 parts per billion, IQ scores drop by about 6 points. In contrast, an increase from 100 to 200 parts per billion results in an IQ drop of 2 more points. An increase from 200 to 300 parts per billion results in an IQ drop of another point. The impact of toxins on the developing brain is permanent. Children who are more heavily exposed to toxins won't reach the same peak cognitive ability as those who have lower exposures. These studies show that there is no safe level of exposure. They also indicate that the way we regulate toxins, which assumes there is a safe level, fails to protect children. The chemical industry argues that the effect of toxins on children is subtle and of little consequence. But that's misleading. Little shifts in children's IQ scores have a big impact on the number of children who are challenged or gifted. Let's go back to our original sample of 100 children and look at a typical distribution of IQ scores. Most of us have IQ scores that fall between 85 and 115 points. Only 2.5% of children have an IQ above 130, which is considered gifted. There are about 6 million children in this group. On the other end of the distribution, another 2.5% of children have an IQ below 70, which is considered challenged. The impact of exposure to a toxin like lead causes a 5-point drop in IQ. This shift results in a 57% increase in the number of children that are challenged, from 6 million to 9.4 million. There is a corresponding decrease in the number of children that are gifted, from 6 million to 2.4 million. Little shifts matter. The impact of exposure to another toxin, like flame retardants, results in a further increase in the number of children who are challenged, from 9.4 million to over 11 million. There is a further decrease in the number of gifted children. Although many, or even most, chemicals are harmless, the cumulative impact of exposures to 3 or 4 toxins is overwhelming to imagine. In Canada and the United States, chemicals are used in consumer products and released into the environment before they are tested for toxic effects. By allowing children to be exposed to toxins or chemicals of unknown toxicity, we are unwittingly using our children as part of a massive experiment. But it doesn't have to be this way. Like the European Union, we could require industry to prove that the chemicals they use aren't toxic before they enter the market.
So what these studies show, and many others, that there really isn't an acceptable level. And particularly if you look at the superlinear relationship I showed you with lead in the video. For a given exposure, the decrement in intellectual ability is actually quite a bit higher at the lowest levels. Now that's not an isolated case. This study by Arden Pope shows the same principle for PM 2.5 or cigarette smoke. You see the steepest increase in the risk of premature death at the lowest levels of exposure. This seems kind of counterintuitive. We tend to kind of think linearly, or we regulate as though there's a threshold. But what if there isn't? Look at another one, benzene and leukemia. At the lowest levels, you see a much steeper increase in the risk of leukemia from benzene exposure. Now, one of the mechanisms that might underlie this is that as our enzymes are saturated, we no longer break down benzene into the toxic metabolites that actually cause leukemia. That's speculative, but that's a possible mechanism. But we all know that women who smoke are more likely to give birth to low birth weight babies. But this study suggests that it's the decrease in birth weight at the lowest levels of exposure, less than 5 cigarettes per day. Now, all of this is quite difficult to believe, that these low-level exposures can have that much consequence. But let's take a look at a recent study from Scotland following a ban on public smoking. What they found is that among pregnant women who didn't smoke, the ban led to a 15% reduction in preterm birth. 15% reduction in preterm birth. There's not a drug that does that. For very preterm births, that is less than 34 weeks of age, there was a 25% reduction. There's already been a systematic review that supports this. And yet, we march on searching for those elusive cures. Women who were exposed to blood lead levels of 5 microgram per deciliter or higher in a study out of Bristol, England, were almost 2 times more likely to give birth prematurely. We found in the home study that a 10-fold increase in organophosphate pesticides were associated with about a 150-gram reduction in birth weight and a half-week reduction in gestational age. Now, this was dismissed by the medical director of the March of Dimes. It's of little clinical significance, he said. It was nice. He said it looked like a very strong study, but a little clinical significance. And on one hand, that's correct, isn't it? 3,500-gram baby loses 150 grams. That's well within the range of just a little bit, right? No big deal. But what if women are simultaneously exposed to a whole variety of these subtle risk factors, each of which may reduce gestation by 3 to 5 days or 3 to 7 days? Doesn't take many for a preterm baby to occur. And that's exactly what happens. We can look at NHANES and see that women are simultaneously exposed to a number of things. How many of you are aware of a concept called the prevention paradox? Anybody? Prevention paradox. Mark? All right. So this is a really cool concept. I didn't come up with it. Jeffrey Rose did. If you haven't read A Strategy for Prevention by Jeffrey Rose and you're interested in public health, please do. It's really, really cool. And it's just a little booklet, so you can read it in a couple nights before you go to bed. All right. The prevention paradox, which seems totally counterintuitive, says the majority of disease and disability occurs in those who are at low to moderate risk. It's just a numbers game. Let me give you an example. Lead exposure. So when CDC lowered the level, now it's not called the level of concern, it's something else that sounds kind of benign, the reference value. We don't want to call it lead poisoning because that might upset people a little bit. When CDC created the reference value of 5 microgram per deciliter as an action level, they did so knowing full well that there are no safe levels of lead. That's what they said. That's what their declaration was. But they said, but we're not willing as a society to spend money, to invest money to protect kids from lead poisoning, which is true. So they set it at 5 microgram per deciliter. They didn't say it quite like that. I paraphrased it, which represents about 500,000 children. And, you know, certainly to some extent, it makes sense. If you look at those 500,000 children who have a blood lead above 5, that just represents the top 2.5% of kids in the United States of a 6-year birth cohort. On average, they lose about 6 IQ points from lead exposure, other factors taken into account. The next strata down, from children who have a blood lead between 2.1 and 5, on average, they only lose about 1.6 IQ points. So it really does make sense to target those high-risk kids, doesn't it? It seems efficient. But here's the thing. If we only target those high-risk kids, there's 2 problems. The first one is we're only acting after the children have been harmed. The second problem is even if we could do something about it at that point, we would only protect to preserve 3 million out of the 23 million IQ points lost in the U.S. population. Now, this concept is true for other conditions, other diseases and disorders, unless 2 things are true. One, if there's truly a threshold, it may not be true. And second, we could define everybody as high risk, and then it would no longer be true. But until we get a handle on this concept, we will fail to protect the public because the medical model is so dominant. We essentially wait for people to become sick to intervene. At best, we tend to pass out pamphlets or brochures, and that's our universal strategy for prevention. One of the last excuses or reasons for not intervening in some of these environmental hazards is because it may not be cost beneficial. Well, there's been about 4 cost-benefit analyses over the past 4 decades with lead, and every one of them has shown that preventing exposure is cost beneficial. This one is particularly powerful. Elise Gould did this in 2009 and found that for every dollar we invest to protect kids from lead exposure and housing, as a society, we'd benefit somewhere from a low of $17 to a high of $220. That's pretty awesome. I think I'd be willing to invest at least half of my retirement funds in that kind of a program. I don't know about you. Let's compare it. What is the cost-benefit ratio for childhood vaccines? Any of you have an idea? This has long been touted as the single most cost-beneficial strategy in public health or medicine in a country like the United States. Anybody have an idea what the cost-benefit ratio is for childhood vaccines? Give me a 5. $5, 1 to $5, 1 to 25, 1 to 50, 1 to 500. It's about 1 to $16.5. Now, to be entirely fair, that doesn't include the HPV vaccine, but it doesn't also include the fact that now a series of childhood vaccines costs $1,500. These vaccines used to just cost a couple bucks when I was vaccinated as a kid. I don't know what's going on. The other thing to put in context is if we look at cost-saving interventions, environmental or population interventions are much more likely to be cost savings than individual or clinical interventions. That is, changing the environment to make it harder to become sick is a good idea. Yet it seems like in our culture of consumption, we've done exactly the opposite. We put in place so many things that make it easy to become sick, easy to become obese, easy to get heart disease, which is why I like to call it the pandemic of consumption. Despite all that, we spend less than 5% of our health dollars on public health or prevention. What's that about? Isn't it time to give prevention a chance? And going back to toxins for a moment, because I used to do this talk to public health communities and moms, and I'd invariably get people coming up and say, okay, you scared the crap out of us now. What do we do about it? Well, the first thing I think we need to know is to be truthful with people. We'd all like to think that there's some laboratory in Washington, D.C. or Sacramento that's testing these chemicals before they're put on the market. But that's not, for the most part, true. The truth is that our children are in those cages up there. By default, we're using ourselves, our children, as laboratory animals to find out if these things are toxic. Now, that's great for people like me, right? Another 100 years before I become useless. But I tell you, I'd really like to retire by the time I'm 60. So if you guys could help, let's fix this problem quick. So what about a simple rule? And it is simple. It needs some caveats. If we didn't evolve with it, avoid it. What are the caveats? Well, lead's elemental, mercury's elemental. It's been there forever, but it was there in extraordinarily low concentrations. Mostly during the Industrial Revolution, it's increased dramatically. But as a rule, we should treat chemicals like they're drugs. We know they're biologically active even at some of the same concentrations that drugs are used and have a therapeutic window. So we can't ignore the fact that they are potent biologic and have potent biologic activity. What are some other things we can do to avoid toxins? Again, sort of general rules. Eat fresh, organic, and unpackaged foods. Avoid canned foods. We're having a lot of fun doing this. We're starting to can in our household. You can get tomato sauce in glass jars. My wife comes home. We have a gin and tonic. We cook together. I'm just a sous chef. Minimize use of pesticides used around the home. In 5 provinces in Canada, we've banned the use of cosmetic pesticides. The city of Irvine, California just had a success. There's some others in California where they've worked with the city to stop the use of pesticides unless there's public health emergencies. Avoid cosmetics, fingernail polish, and lotions. I've got 3 kids. They're all daughters, and I tried so hard. I try to tell them, look, you guys are beautiful like you are, right, Dad? It doesn't work. But of course, they're being bombarded by all these airbrushed models, and they've got to live up to that somehow. Maybe we should ban marketing to children. Support bans on smoking in public places and cosmetic pesticides. And finally, and most importantly, this is where many of you come in, we need to find ways to force our policymakers to update the chemical management plans and reduce industrial pollutants. I showed you for some of the most well-established toxins and pollutants, not only is there no apparent threshold, there appears to be steeper effects at the lowest levels. That means we've underestimated the impact of these toxins on human health. It means that without knowing anything more about stem cells or genetics or having new drugs, we can make a big difference in people's lives. The work you guys do is so important, but not that many people know about it. They keep pointing to physicians, and I'm a physician. I don't have a chip on my shoulder because I didn't get to med school. But physicians can't solve lead poisoning. They work in a clinic. They work in the hospital walls. We need people who are in public health to solve these types of problems. We can't live in a state of perpetual doubt, Daniel Kahneman said. So we make up the best story possible, and we live as if the story were true. We have, for the past 50 or more years, lived out of a story that with enough investment will find cures for what ails us or kills us. This story, which worked well for infectious disease, gave us a sense of comfort in the face of death and disability of uncertain etiology. But the never-ending, ever-elusive search for cures for chronic disease has largely been a failure. The few successes, like the decline in lung cancer, have largely been the result of efforts to prevent disease. We know enough to prevent a lot of death, disease, and disability, but for the most part, we don't. It won't be easy, but if we want to make a difference in children's lives, it's time to revise our story and give prevention a chance. Thank you.